Salam, madam. I have studied dried blood spot thoroughly and have collected almost 18 articles. I already sent you the literature survey regarding dried blood spot sampling to you by email. Now, why the dried blood spot sampling is necessary or important in therapeutic drug monitoring? First of all, why TDM is necessary? Actually, the all the anti-tuberculosis drugs are potent, and there is individual difference in pharmacokinetics. Like some patients have different pharmacokinetic profile regarding elimination, regarding absorption, and regarding what to say that metabolism of drugs. Mm, so different liver function LFTs, different LFTs, so there is different pharmacokinetics in individuals. So therapeutic drug monitoring is necessary to adjust the dose to avoid from toxicity, and to avoid subtherapeutic effect, because tuberculosis is a disease in which mycobacterium uh, tuberculosis is not easily killed uh, by subtherapy if the drugs are given are administered in subtherapeutic way. So there is a need of 3 or 4 drugs uh, that should be bactericidal, and then if they are administered in appropriate dose and appropriate concentration, then mycobacterium can be killed, and the disease will be cured effectively. So if the in intensive phase, after 2 months of intensive phase of tuberculosis, if the TB is the any lab investigation shows positive, is still positive after 2 months of intensive phase treatment, then there is a need of TDM, like therapeutic drug monitoring by plasma concentration, like taking venous blood by syringe, and then examining plasma concentration of drugs, uh, and ruling out or sorting out what the problem is, like why the patient is not relieving, why the patient is not showing a response to anti-tuberculosis treatment. And now the dried blood spot actually have several advantages over plasma, like therapeutic drug monitoring by plasma concentration or venous blood. uh, so dried blood spot have some advantages over normal conventional venous blood sampling. uh, like first of all, dried blood spot technique was first introduced in 1963 by a scientist to measure phenylalanine in neonates as part of phenylketonuria screening. Uh, Dried blood spot uh, also have some other advantages over conventional sampling, like easy storage. Storage is very easy, normal conventional blood sampling like venous blood sampling requires uh, storage at cool temperature, but dried blood spot don't need any type of cool blood. uh, the sample is taken on a filter paper, then it is dried for 2 hours or 3 hours, then can be packed inside the packing, then can be transported or mailed by courier or mailed by any service to the laboratory. It is also have some other advantages like easier sampling. Normal lay person can also do dried blood spot, and also useful in low income countries like Pakistan, like uh, what to say that TDM is very expensive. Therapeutic drug monitoring by plasma concentration is very expensive, but dried blood spot is not so much expensive. It is cost effective. So another reason is for second line drugs, dried blood spot is necessary because second line drugs like moxifloxacin, clarithromycin, linezolid are potent drugs. So their concentration at very appropriate manner or accurate manner depends a lot. If their concentration exceeds, there comes toxic effects, so need to adjust the dose according to their appropriate concentration or cmax. So dried blood spot is necessary for second line agents. So also why the TDM is necessary? Therapeutic drug monitoring. Why therapeutic drug monitoring is necessary? Because of emergence of resistance and tuberculosis. Not if there is individual difference in pharmacokinetics, there comes resistance to the drugs by due to subtherapeutic dosages of drugs, like what to say that there is emergence of drug resistant tuberculosis, multiple drug resistant tuberculosis, MDR. Like MDR also, except MDR, there is XDR, extensive drug resistant tuberculosis, that is very dangerous and very difficult to treat. Like in to adjust the dose, to avoid from resistance, to avoid from drug resistant or multiple drug resistant tuberculosis, dried blood spot sampling is very cost effective and very simple and easier. But there are problems like uh, uh, there are two type of validations in dried blood spot sampling. Like first is analytical validation, second is clinical validation. Analytical validation is by the different method development. Like dried blood spot sampling is checked by different methods, like first uh, finger prick, like by lancet. uh, Blood spot is taken by finger prick. This is known as capillary blood. In normal conventional sampling, we take blood from veins, so that is known as venous blood. But in dried blood spot, we take blood from feet. In case of children, we take blood from feet, foot. In case of adult patient, we take blood from fingertip by lancet, pricking by lancet. So first spot is wasted, then another spot is taken as a sample. First spot is wasted because of the because this is capillary blood. So capillary blood is mixture of interstitial fluid and intra is a mixture of interstitial fluid and intracellular fluid. So there is some wastage, like different waste material in the blood, capillary blood. So the first spot is wasted and another spot is taken. uh, like uh, Also capillary blood is mixture of venous blood and arteriolar blood. So there is something difference in capillary blood and venous blood. Venous blood sampling is conventional sampling, and dried blood spot is a different method, alternative method of taking capillary blood is just small blood. So it has more advantages, patients are usually again and again sample blood sample is taken from veins by cannula, but in dried blood spot there is no any need of cannula, especially it is good for children. So also analytical method of validation is good in dried blood spot, after taking blood and taking on filter paper, then it is dried, then it is taken into a box or bag, uh, free from humidity and high temperature etc. Then it is dried blood spot is analyzed in the laboratory. First the sample of dried blood spot is by different solvents, the sample drug of interest is separated from the sample. Then for drug of interest is separated from the dried blood spot filter paper. Then the drug of interest is further analyzed by chromatography, HPLC, high pressure liquid chromatography, or gas chromatography coupled with mass spectrometry, or ultra pressure liquid chromatography, UPLC. Because of dried blood spot is taken in a very small quantity, so it is analyzed by very sensitive methods, like ultra pressure liquid chromatography, UPLC, coupled with mass spectrometry. Also our normal liquid chromatography coupled with mass spectrometry, or gas chromatography coupled with mass spectrometry, and also HPLC, high pressure liquid chromatography. Further I will discuss in another video.